The latest moves to contain the pandemic have exposed even wider differences across the United Kingdom. Northern Ireland is now set to impose the toughest coronavirus restrictions anywhere in the UK. Wales is set to ban visitors coming in from the worst affected parts of England, Scotland and Northern Ireland. And in England, the new three-tier system has started with the Liverpool region at the highest alert level. So we start with Northern Ireland, which in the past week has reported the highest rate of infection in the UK. From 6 p.m. on Friday, all pubs and restaurants, hairdressers and beauticians will have to shut their doors for a month. Supermarkets and off-licences will not be allowed to sell alcohol after 8 p.m. And schools will close for 2 weeks, one of those being the half-term break. It is not a full lockdown because takeaways are allowed, shops will be open, so will gyms for individual training as well as childcare facilities. Let's start with our Ireland correspondent Emma Vardy in this report.
Nightlife no more. Soon the streets of Belfast will again be subdued.
I don't know if it's the right move to make. The restrictions and stuff are kind of hard. I don't see how buying alcohol after 8 o'clock is going to make a difference.
But clap they might. An extended holidays on the way for pupils. 2 weeks instead of 1 for the half-term break. But the restrictions have come with just a few days' notice for parents in Northern Ireland who will now have children at home from Monday.
Nobody knows what they're doing and they're just changing the rules every single day. Especially for people who are going to school, people have no childcare, people have to get people to mind their kids. I think it's terrible.
It doesn't help, especially parents that can't help their kids properly. Some need school and need the extra help as well.
It's always good to get a bit of notice so that you can make plans and contingency plans. You have a lot of children entitled to free school meals, things like that you have to check out in the background and make sure that those children are going to be catered for. It can't be done just instantly.
A return to tighter restrictions mustn't roll on indefinitely, say political leaders. But after late-night disagreements at Stormont last night, it took some time for all parties to agree on just how far they should go.
The tougher restrictions were a compromise after Sinn Féin had pushed to go further, but the DUP was holding back.
These decisions will make a huge impact on people's lives, but they are for 4 weeks. We're very determined that this will be a time-limited intervention.
The public health advice initially suggested that 6 weeks would be the optimum, but clearly after discussion, what we've arrived at is a 2-week holiday for schools, but that's very much based on the public health advice.
This restaurant in Belfast had only just reopened a week ago. Now it's estimated the new closures will come at a cost of £700 million to Northern Ireland's economy.
I just feel numb. I feel we've put so much into this, and I feel hospitality are getting hung out to dry.
Hello, I'm Amy and I'm home self-isolating for the next...
In Derry and Strabane, a lot of pupils are already off. This area has the highest rate of infections in the UK. Spare a thought for Jacob, into his 3rd week of isolating at home, where his mother and brother have tested positive.
How are you coping?
That's very, very tricky. I have to wear a mask every time I leave my room. I have to disinfect the kitchen, I have to disinfect the bathroom as well.
The slow but steady creep of rising cases since August has seen medical advisors in Northern Ireland pushing to lock down much harder.
Too little, too late. We need to be stricter, we need to have more severe restrictions for a longer period of time because we have a real problem in secondary care in hospitals and we don't want to be overwhelmed.
Once again, the wait begins to see whether these restrictions on the lives of people in Northern Ireland will have enough of an effect and whether larger parts of the UK may follow.
Cases of the virus here have risen dramatically. Hospital admissions have risen too. So today, Northern Ireland reactivated its Nightingale Hospital, the facility set up to look after COVID patients. Northern Ireland being the first part of the UK to re-establish its Nightingale facility. But really today, I think the problem was that ministers had significant fears that Northern Ireland could just be a short while away from those hospitals being overrun.
Emma, many thanks again. Emma Vardy there with the latest for us in Belfast. Let's have a look at the latest official figures then, just to underline the situation. 19,724 new infections were recorded in the latest 24-hour period. It means the average number of new cases reported per day in the past week is 15,767. Hospital admissions are rising. On average, 688 people were being admitted every day over the past week. That number does not include Scotland. 137 deaths have been reported of people who died within 28 days of a positive COVID-19 test. It means on average in the past week, 91 deaths were being announced every day, and it takes the total number of deaths so far across the UK, according to the official calculation, to 43,155. Well, I mentioned Wales a little earlier because the First Minister, Mark Drakeford, has announced a travel ban on people visiting Wales from parts of the UK with the highest rates of infection. Mr Drakeford said he'd gone ahead with the decision after the Prime Minister, Boris Johnson, had refused to impose travel restrictions in England. The ban is expected to come into effect at 6 p.m. this Friday, but some critics are asking how the ban is to be enforced. Our Wales correspondent Hywel Griffith has more details.
A quiet country manor sheltered so far from COVID's second wave. But businesses here in mid-Wales now find themselves on a political front line. Since talk of a cross-border travel ban started last week, customers have been cancelling. It's likely that Tier 2 and 3 lockdown areas in England, the central belt of Scotland and all of Northern Ireland will be included. But the details still aren't there.
You know, I'm getting phone call after phone call. Can we come? Are you still open? Do we have to do this? What are your restrictions? Do we put a block on those people and protect our own? Or, you know, do we allow them to come and just take extra precautions? It's that really weird kind of limbo phase that we're in at the moment.
OK, and where is home?
Travel restrictions aren't new within Wales. Officers already carry out spot checks and issue fines.
So we're just stopping people to check the purpose of their journey.
The Police Federation says this extended ban will be unenforceable, but the Welsh Labour government says it must act because the Prime Minister won't.
So if no letter from the Prime Minister has been received in reply to my request, I have therefore asked for the necessary work to be brought forward, which would allow for devolved powers to be used to prevent people from travelling into Wales from high prevalence areas of the United Kingdom.
This border won't be sealed. People will still be allowed to travel in and out for work and for education or to give care to a loved one. But day trips and holidays won't be allowed if you're travelling from an area with a high number of COVID cases. Large parts of Wales are already closed to tourists. Llandudno's been under lockdown for almost a fortnight. With no visitors allowed in, many businesses have been starved of their customers, most of whom travel from over the border.
It's heartbreaking. More than 70% of our trade is from outside the town. So this 70% is gone. Straight away it's gone. All the hotels will be shut, so it will be a ghost town again. For how long, I don't know.
The UK government says it's disappointed Wales is acting unilaterally. The ban then is a reminder that this border is also a political divide. Hywel Griffith, BBC News, Powys.